Hi students, I am Dr. Badrinath and in this video we will see the oral hypoglycemic drugs or agents. Oral hypoglycemic drugs. Okay. Here symbolically I showed the onion here. Onion is very good for diabetic patients. Onion, excellent. It prevents the diabetes, it avoids the diabetes, it treats the diabetes. Okay, it is one of the good. Wherever onion is there, you don't leave it, you eat it first. Okay, daily if you are taking a 50 grams of onion, it is very good for your health, especially diabetic health. Okay, it prevents the diabetic also. That is the power of onion. That's why symbolic, which is taking orally. That's why oral hypoglycemic agent, which reduces the sugar levels in the body, in the blood, Okay. Yeah, we know very well hyperglycemia and hypoglycemia, these two terms, very important. Here, hyperglycemia, this column, and this column is for hypoglycemia. So you can see here high crystal, number of crystals are there. For symbolically, I have shown the hyperglycemia here, low blood sugar. What is this hyperglycemia and hypoglycemia? That we will say. Hyperglycemia, it refers to an excess of the glucose in the bloodstream. See here how much excess is there, the sugar in the bloodstream. Okay, blood sugar levels rises more than the 130 mg per deciliter. 130. Okay, now it is calling it as a 120 like that. No problem at all. What either it may be 120 or 130, whatever it is. 130 you can take as a standard. If it crosses the 130, then only you have to say he is a diabetic patient. Hypoglycemia refers to a deficiency of glucose in the bloodstream, very less quantity of the sugar. It is a problematic. You cannot stand also. When there is a less blood sugar level than the normal, you will be fell down like this. See, you will be fell down. Okay. So high blood sugar is also problem. Low blood sugar is also problem. So you have to maintain the normal blood level. See here, blood sugar level drops less than the 70. 70. So normal blood sugar is a 70 to 130 is a normal. If it crosses 130, hyperglycemia. If it less than the 70, you can say it is a hypoglycemia. Okay. Yeah. This is the syllabus as per pharmacology, as per your university. Okay. Here in this pharmacology of drugs acting on endocrine system, here you can see A, B, C, D, E, F. In the E, you can see oral hypoglycemic agents. That is the red ink. The highlighted with the red ink is the today's video, right? Yeah. What is this oral hypoglycemic agent? Why we are calling? See, why you used oral? You are taking orally because actually insulin is very good for diabetic patients. But insulin we cannot take orally. It is one of the biggest disadvantage. So we have to take some medication for diabetic patients through orally. Okay, that's why they are used orally, effective orally. See, this hypoglycemic drugs is also called as a anti-hyperglycemic drugs. See here hypo, here anti-hyper. Anti-hyper. See, whenever your body shows the hyperglycemia, you have to take these drugs so that it reduces the blood sugar level. That's why it is called a orally. It is a very good for diabetic patients. They have to take, they must take compulsory. Okay. See how they're reducing the blood sugar level. See, from high blood sugar, it is reduced to low blood sugar. Hypoglycemia. It reduces the blood sugar level used to treat the hyperglycemia excess. Okay. Classification is very, very important. And if you know the classification, fingertips, total concept will be your fingertips. Okay. This classification is as per the pharmacology book. KD Tripathi. Here I have shown now this as per this. See, first classification. Enhance A, see blue line A enhances the insulin secretion. Enhances. See, it doesn't secrete the insulin, these drugs, class A drugs. enhances. Already insulin is releasing, but it enhances the releasing. That's very, 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 very important point. All these drugs enhances. Students, some students, they are confusing it. Secretes the insulin. It doesn't secrete. These drugs doesn't secretes. It aids the insulin. Okay. See, all these next first in this 1, 2, 3, 4 is there. 4 classes. Okay. For second class, we will see B. Now we will go to back. No problem. Don't worry. Be cool. Be calm. Okay. B, overcome the insulin resistance. See, if you are using a insulin, go on, 5 years, 10 years, 15 years, if you are using, one day will come where insulin will not work. In such a cases, you can say it is a insulin resistance. Your body become a resistance to the insulin. Even though you are taking a insulin cannot work. In such a cases, you have to overcome the insulin resistance by using these drugs. Okay, 1, 2, biguanide. Okay, it is that we will see later. Next, see miscellaneous anti-diabetic drug. Miscellaneous. Here also 4 classes is there. 1, 2, 3, 4 classes. See, I will tell you some tricks how to remember the names and how to logically we have to see this. First, we will see classification. We'll start with the first enhances the insulin secretion. First point is very, very important. Number 1, sulfonylurea. Sulfonyl, sulfur is there in the urea. Like that you can remember. Sulfonylurea. First urine. First, very important class. Sulfonylurea. How? Very number of times it was appeared in GPAT, PG set, what not, MD entrance, medical entrance, PG entrance. This sulfonylurea, it blocks the channel. Which channel? TV9, TV5, ABN channel. Okay, all these news channel, not that channel. Okay, KATP, potassium. Adenosine triphosphate, you know very well. Potassium channel blockers. K. You have to remember this. ATP stands for Anantapuram, which is their district in the Andhra Pradesh in India. Okay. KATP channel blockers. Sulfonylurea. You went to the Anantapur for urination to go. Like that you can remember also. It blocks the potassium. K is the king. Okay. Like that. There is a 2 generations are there. First generation, second generation. First generation, Tolbutamide. First generation, sulfonylurea. Main mechanism of action, KATP channel, all these drugs. First generation and second generation, both KATP channel blockers only. See, 50% of the mechanism of action will complete here only. It belongs to sulfonylurea. Enhances the insulin secretion. Okay. First generation. Tolbutamide. All these box also I have kept additionally, apart from the Tripathi book, I collected this one. This is Tripathi classification. And this is additional Tolbutamide. Tolazamide. This is here, see, tall. First generation is Tolbutamide, Tolazamide. If you want to remember one more technique also there, amide. All are amides only. First generation, amma, okay, ma, like the amide. All are amides. See here, ending, amide. All are acetohexamide, chlorpropamide, AC, like that, like that you can remember, practice, okay. Second generation, GLI, very important logic here. First one is amides, second one is a second generation is a gli. First generation also comes from mata, okay, amide. Second generation, glibenclamide, glimepiride, gliclazide, glipizide. See, all gli starts here. Gli starts with the beginning. Whereas here, see, in the second one, gli starts from the middle of the word. See, when it starts from first, beginning of the word, it comes in the sulfonylurea. When it comes from the between of the word, that is middle of the word, glinide. See here, glinide. Here also, glitinide, glinide. You can remember, see, gli is there, nide is there. Meglitinide, phenylalanine analogus. It looks like a phenylalanine. That's why it is called analogo. It looks like phenylalanine. In the examination, this is also very important. Okay, phenylalanine. Next is a, see, nateglinide, repaglinide, glucagon, like a peptide. See, this is a glucagon like peptide 1 receptor agonist. Agonist means helps. Agonist is different. Antagonist is different. Agonist means which helps. Okay. See, this GLP, also called as a good laboratory practice. GLP-1. Okay. This GLP-1 receptor agonist, these are some injectable drugs. This is also a number of times it was appeared. GLP is injection, good laboratory practice. In the lab, there was an injection. Okay. Exenatide, see here, tide, gluenide, see, tide will come here, TIDE, TIDE. Here, TIDE is there, no, peptide, TIDE. That words are important. Here also glue will come, glue, just like a gum. You know gum, no? Gum, glue, like that you can remember. Exenatide. You have to practice number of times, then only you can remember. Okay, listening one time is not sufficient. Next, DPP-4 inhibitors. Inhibitors means which inhibits? See here, GLP-1 agonists. Here, DPP-4 inhibitors, which works against. See, DPP means dipeptidyl peptidase. Dipeptidyl peptidase. Okay. See, sitagliptin. Gliptin comes here. Here, glinide will come. Whereas here, gliptin, viladagliptin, sexagliptin, okay, allogliptin, allo, okay, linagliptin, like that, all gliptin, glinide, gliptin. These words are very, very, GLI is very, very important. Okay, right. And you can see here, Sita, the character of Ramayana. See, like that you can remember. Line. Okay. Sita is in line. Next, Vilda means Vali. Vali is also character of Ramayana. And Saksa, 6, you can remember. 6, roll number 6, like that, remember. Alone. Roll number 6 is allogliptin. Like that you can remember. Okay, you have to practice well. Next is overcome the insulin resistance. See here, mechanism of action itself, here in the name itself, mechanism of action is there. That point very important in the competitive examination. DPP-4 means Ramayana, gliptin. Okay, GLP injections, like that you have to practice. Overcome the insulin resistance. See, whenever insulin is not working in your body, you have to begin with biguanide. Biguanide. See, biguanide, AMPK. This is very important. AMPK activator. It activates the AMP. Metformin. Metformin. Meet your friend formally, like that. Metformin. Thiazolidinediones. Thiazolidinediones. PPAR activator. See, whenever insulin is not working, you have to activate. That's why both are activators here. Both are activator. AMP is also activator. PPAR is also activator. Here, thiazolidinediones. See, piaglitazone. Pioglitazone. Zone is there here. This is a keyword here. Zone. Metformin, your friend, in a zone. Zone also here also is there. Nes, Jones. 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 Zone. PP, yeah. By wearing PP kits. Okay. Miscellaneous anti-diabetic drugs like alpha-glucosidase inhibitors. See, inhibits the alpha-glucosidase, like a acarbose, meglitol, oglibose, very important. Acarbose, Ogly Bose, very important, just like Subhash Chandra Bose. Bose is a boss. He's a freedom fighter for India. We know very well Subhash Chandra Bose, Netaji Subhash Chandra Bose, hats off. Bose, Ogly Bose, Akar Bose. Next, amylin analagu, which works like a amylin. Amylin is good for insulin. It helps the insulin. Like a pramlinitide. Okay, pramlinitide. Like a promise. Pramili. Okay. Next, dopamine D2 receptor agonists. Bromocryptine. DB. Like that. Dopamine. Bromo. Like that you can remember. DB you can remember. Okay. Next is sodium glucose co-transport 2 inhibitor. Here also glycan. Gliflozin. Sodium glucose. Co-transport. See, whenever it comes here, co-transport, it is a flow. See, that flow you have to remember. Sodium glucose flow. Okay, that inhibited by the flow. Here FLO is there. Like that you practice. Okay. Yeah, first we will see sulfonylureas. Sulfonylureas indicated by the symbol SU. Sulfonylurea. All having a same pharmacological profile. All sulfonylurea. There is a two generations are there. First generation, second generation. Same pharmacological profile. This is the basic structure of the sulfonylurea. Here you can see the sulfur in the compound, and this is a urine. Ammonia is there, no, in the urine. So here urine, ammonia is there. These are the R1, R2 groups are the different for different sulfonylureas, but basic structure is the same. Okay, and it is not effective in juvenile diabetes. Juvenile diabetes is also called as a type 1 diabetes. Number of times it was appeared in the question. N number of juvenile diabetes is nothing but a type 1 diabetes. Type 1 diabetes is nothing but a insulin dependent diabetic mellitus. IDDM. Okay. Without that, it is not at all effective in the first one because insulin is not, they are taking insulin from extra. Okay, insulin is not secreting in the body. Beta cells are not secreting the insulin. Okay, these drugs, sulfonylureas, help the insulin, but helps to increase the synthesis of the insulin. But if insulin is not there, sulfonylureas will not work. Effective only in the normal subject, type 2 diabetes, non-insulin dependent diabetes mellitus. Okay. Yeah, first generation, second generation. First generation is not preferred generally. That keep in these are the first generation which I have already shown in my first video: Tolbutamide, Tolazamide, Chlorpropamide, amide, Acetohexamide. Second generation is always preferred. These are more potent also. Second generation, clinically superior. That is very, very important. In the examination, they will ask definitely why second generation sulfonylureas are preferable than the first generation. Then you have to tell it is a more potent, clinically superior than the first generation. Like a glipizide, gliclazide, okay, glimepiride, same as drugs what I have shown in the classification. Yeah, mechanism of action you know very well. It KATP channel blockers. This is the main. Enhances the insulin secretion. Enhances from beta cells. Pancreas we know very well. Pancreas is islets of Langerhans. It consists of 3 types of cells. In that beta is one, but it cannot replace the insulin. Sulfonylureas is not replaced to the insulin. It helps the insulin. Insulin release is provoked even at a low blood sugar concentration. See, in our body, insulin is secreted when there is a high blood glucose levels in our body. But whereas a sulfonylurea, even though there is a little increase in the insulin blood sugar level, insulin will be secreted. That is very good for diabetic patients. In general, insulin is released only at a high blood sugar concentration, very high blood, not 130, 200, 300, 400 only. Whereas if you are taking sulfonylurea, even at 130, 135 also, sulfonylureas will start releasing the insulin. Okay, enhances the insulin release. Yeah, here you can see one shot, two birds. If you remember this very simple mechanism of action, one shot, two birds, because SU stands for sulfonylurea, you know very well. Megli. I have shown no Megli. Here it comes. See, meglinitide. So, sulfonylureas and meglinitide both having a same mechanism of action. KATP channel blocker. Yeah. Now we will see very simple diagram. Don't get confusion. Number of things are there. Don't leave it. Everything. See here first pancreatic beta cell. Here insulin is there. This insulin is present in the pancreatic beta cell. It is releasing to the into the bloodstream. See here how insulin is releasing here. This insulin release, how these drugs enhance, same here too, sulfonylurea SU, Megli, it blocks the KATP. See here, these two are the KATP. Here I have shown no KATP channel. These two channel will be blocked. See here how it is blocked. See, blockage. Sulfonylureas blockage. So when it blocks, potassium will not enter. Since it is a potassium channel, potassium will not be enter into the beta cells. When potassium will not enter, there is a very less concentration of potassium in the beta cells, isn't it? See here, potassium concentration will become less in the pancreatic cell. Then it causes a depolarization. This depolarization causes a intake of calcium. So instead of potassium, if you block the potassium, calcium will enter. That is called a depolarization. When you stop the potassium, calcium will enter. That is called as a depolarization. When calcium enter, see here, when calcium enter, insulin will be released. See here, it helps the insulin release. See, only one. This diagram very simple to understand. Also, easily can remember. Practice it. Okay, one shot, two boards. Keynote. Sulfonylurea augment increases the second phase of insulin release. It is also appeared number of times. Which see insulin release is a three phases. First one is a basal phase. Basal phase. See here insulin secretion. It releases at a low level. Basal, very basic level. Base, basal, base level. Now high glucose level after taking a meals, after taking a tiffin, insulin secretion is increased. See, this is called a first phase. See how it is increased. Now it reduced and again it is increased, enlarged to a second. This is called a second. This first phase and second phase will happen in high glucose levels. When your body consists of a high glucose level, then only first phase and second phase will take place. Okay, otherwise insulin will not be released. Only basal level only released. This SU, sulfonylurea, increases the second phase of insulin release. The second phase. That is important. A number of times it was appeared. Which phase of insulin release is increased by the sulfonylurea? Basal, first phase, second phase, third phase. Second phase. Sulfonylurea does not effective. If there is no beta cells are not functioning. See, beta cells is not there. Insulin is not at all there. These drugs will help only the insulin. If insulin is not there in the body, like a removal of pancreas, pancreatectomy, this is also important bit. In pancreatectomy, which of the following drugs will not work? Sulfonylurea will not work. If beta cells are not functioning, yeah, this is a drug-drug interactions of sulfonylurea. Sulfonylurea actions will be reduced with all these drugs. So don't take sulfonylurea with these drugs. Red mark. See the red mark. Diuretics, niacin, phenothiazine, sympathomimetics, which stimulates the sympathetic system. Atypical antipsychotics. Whereas this one is very helpful. It increases the sulfonylurea action. Combination is very good. Excellent combo offer. Okay, you can give it beta blockers, chloramphenicol, all these chlormyricin, clarithromycin, etc. This is the mechanism of action of third class, GLI, and fourth class, DPP4. See, GLP-1, good laboratory practice, I have already explained what it causes. See, it helps, this is also helps the pancreas. See here, pancreas, beta cells is there. See here, it increases, plus mark is there. It helps the beta cell so that insulin increase will be released. Okay. And it also works by decrease. This is also very good action. It having a negative effect on the alpha receptor. Alpha receptor secretes the glucagon. Glucagon is a hormone which works against the insulin. Okay, so in the one hand, it enhances the insulin release. On the other hand, it decreases the aponin, that is a glucagon. So both leads to very good effect. So both are having a action on the liver, and it decreases the plasma glucose. This is the ultimate result what you will get with the help of GLP. Next, DPP4 inhibitors, gliptins. In the last class we have shown this. It help the GLP. See, because GLP will be breakdown here. See, DPP peptide inhibitor. This is the enzyme. This enzyme will causes the breakdown of this one, GLP breakdown. Whereas a DPP will avoid this enzyme so that it retains the DPP4, retains the GLP1. So it helps always. So for sustain, it helps to sustain the GLP in the blood. Okay, so that's why you have to take with the GPP. Both are very good combination. You can give GLP plus DPP4 inhibitors. Yeah, metformin, metformally. Metformally. See, this is a oral anti-diabetic drug. It belongs to biguanide class. Insulin sensitivity will increase. Insulin resistance will be decreased. Insulin resistance decreased. Insulin sensitivity will be increased. Belongs to biguanide class. Metformin is the only drug available in this class. No other drug is available. Metformin. It activates the enzyme AMP. This is very important action. AMP dependent protein kinase K. Okay, protein kinase. So here you can see metformin, how it works. Okay, this stimulates the AMPK. This AMP glucogenesis, it avoids the glucogenesis. Gluconeogenesis means formation of a glucose from amino acids. That is called a gluconeogenesis. It will be avoided by the metformin. That's why it is very helpful. If gluconeogenesis is there, all amino acids, fats in the body will be converted into glucose. So you have to take metformin. So it avoids. And other actions increases the glucose uptake by the muscles, bones. You will become a very strong. Okay. Insulin increases insulin sensitivity, increases the fatty acid oxidation, decreases the intestinal glucose absorption. See, if you are taking a glucose, your glucose will be absorbed into the blood. That will be avoided by the metformin. Metformin do not causes the insulin release of insulin from the pancreas. Very important point. But presence of insulin is essential for their action. Insulin is compulsory. Another drug is there that was banned. Metformin, penformin. See, that's why I symbolized here pen. This penformin is banned. Number of times it was appeared. Why penformin is banned? Which drug is banned? Penformin is banned. Why penformin is banned? Penformin is another member of this class. It has banned due to the higher risk of lactic acidosis. Lactic acidosis. See here, lactic means milk. See here, lactic acid. Lactic acidosis. In the milk, acid will be secreted if you are using this drug. So your milk will become mother milk will become acid. It will be very dangerous for baby. That's why it was banned. Buildup of lactate in the body. So it leads to lactic acidosis, right? And also important, lactic acidosis mean lactic acid concentration in the body is increased. So that systemically you will get acid. More pH will be changed to acid side. Okay. Pioglitazone, what it is? It is a oral anti-diabetic drug, belong to thiazolidine class. Zone is a keyword. Z-O-N-E. Two members are currently available. Pioglitazone, rosiglitazone. Rosiglitazone is banned. Keep in your mind. That is also important with number of times it was appeared. Pioglitazone, how it action? Primary action, PPAR receptor in the nucleus. So final action of the insulin sensitizer, we know very well, it increases the insulin sensitivity, decreases the insulin resistance, and also increases the uptake, increases the insulin mediated glucose uptake. Around a 30 to 50% of glucose will be uptaken, glucose uptake by the liver, glucose uptake by the muscle, glucose uptake by the fat adipose tissue. So it started taking off a glucose from the blood, so that blood level glucose will be reduced. Pioglitazone requires the presence of insulin for its pharmacological action. Compulsory insulin must be there. See, this is a rosaglitazone. Rose you can keep in your mind. Rose, glitazone. Because why it is banned? Why number? See here, risk of myocardial infarction. See, heart. Love symbol is there. Heart. This is a heart. Rose is there. Heart is there. Risk of myocardial infarction, congestive heart failure, stroke, death. That's why it is banned. So heart will be broken if you are taking a rose. Don't take the rose. Rosiglitazone. Heart will be broken. That's why it is banned. Mechanism of action of the BOS, alpha-glucosidase inhibitor. Very simple. Very simple. Very easy. See here, mechanism of action Vaglibos, alpha-glucosidase inhibitor. See here, acarbose. This is alpha-glucosidase enzyme here, which is present in the intestine. Microvilli, you know very well. See, this is the main enzyme here. What it causes, it absorbs the sugar from the food into the blood. It absorbs. See, when you stop this, when you kill this enzyme, it will not be absorbed. Sugar, even though you are taking a lot of sugar, it will be entered into fecal matter, waste. Okay, it will not enter into the blood. That is only the what BOS will work. Voglibose, acarbose, alpha-glucosidase enzyme inhibitors. Okay, very simple. See here, I have shown here without acarbose, with acarbose. This is the stomach, GAT, intestine. See how much amount of sugar is entering here without acarbose. If you are taking acarbose, see very less quantity of the sugar will be entered into the bloodstream. Yeah, alpha-glucosidase inhibitor here I have compared with the all three, acarbose, meglitol, voglibose. See, acarbose, see last point, very important, higher efficacy than the voglibose. Very good, very powerful action, acarbose. A starts with A. A is good, like that you can remember. A is not good. It works very potent than the voglibose. V is at last. Voglibose, worst in the action, but when you compare the side effects, this is good. See here, higher efficacy than the voglibose, acarbose. See, voglibose is a newest and it is having a less side effects. So very less effect. It is very good, but potency is less. See here, voglibose is potency is less. Potency, okay. Side effects also less. But action is not that much of acarbose. Acarbose is very powerful, very great action, but it is having a side effect. Okay, like that. Okay, yeah. So I will stop here. Jai Hind, and thanks to Subhash Chandra Bose for helping us. So I will end my this video.